You are listening to the Two Disabled Dudes podcast. I'm Kyle Bryan.
And I'm Sean Baumstark. Together, we're navigating life with disability.
Sean and I were both diagnosed with a rare, debilitating, life-shortening disease that has affected our physical abilities and causes us to live with urgency. We are constantly looking for the next challenge, not only in spite of our disease, but because of it.
We are two dudes who constantly challenge our own abilities, and we invite you to do the same.
Hi, it's Kyle and Sean. We're excited to bring you a series of interviews focused on Rare Disease Day, which is coming up on February 28th.
On February 15th, we have Nicole Boyce, the CEO of Global Genes, on the show. On February 20th, we have Max Bronstein, Chief Advocacy and Science Policy Officer at the Every Life Foundation for Rare Diseases.
On February 22nd, we have Paul Melmeyer, Associate Director of Public Policy at the National Organization for Rare Disorders. And on February 27th, we have our very own Ron Bartek, President and co-founder of the Friedreich's Ataxia Research Alliance.
Now, on with the show.
All right, we are here with Paul Melmeyer, the Associate Director of Policy for the National Organization for Rare Disorders. We're really excited to talk to Paul today about NORD and how NORD fits into the rare disease community, and just about what Paul does for NORD and for the rare disease community. So, Paul, thank you so much for joining us.
Thank you, Paul.
It's a pleasure to be here. Thank you.
Awesome. Also, we got Sean on the line too. So, me and Sean will be grilling Paul for a few minutes and picking his brain about how we can all move the ball forward for rare disease. So, Paul, why don't you start off by just telling us what your role is at NORD?
Sure, I'd be happy to. So I am one member of a four-person team in NORD's Public Policy Office, which is here in Washington, D.C. As the Associate Director of Public Policy, I focus on our federal government relations, and so I am our lead lobbyist on Capitol Hill, and I also am our representative working with the Food and Drug Administration in therapeutic regulatory matters that influence rare diseases. I also work with the National Institutes of Health, the Social Security Administration, Center for Medicare and Medicaid Services, and some other federal regulatory agencies that impact individuals with rare diseases. So my role focuses on federal policy. Also in this office, we have an individual named Tim Boyd focused on state policy, and several other individuals, vice president as well as an assistant, who kind of span the work, assisting the two of us in our work on federal and state policy.
Beautiful. Awesome. So, Paul, why did you get involved in this? I think we were talking earlier, and you said you've been involved for 4 years with NORD. And what drove your interest in getting involved in the rare disease community?
So I first came to NORD in February of 2013. I actually had a very good friend who was working at NORD at the time, and I wasn't particularly involved in rare disease policy. I had been working within health policy in Washington, D.C. for a little while before then, but my friend really attracted me to the organization, and after working here for a little while, I was really enamored with the work that this organization does on behalf of individuals with rare diseases. I take a particular passion in looking at the healthcare sector and seeing what areas may be most neglected, where the most need is within healthcare. And it was clear very quickly to me that the lack of treatments and the lack of awareness and lack of diagnoses that are present within the rare disease community would be a fantastic way for me to get more involved, and a fantastic opportunity for to try to really make a difference in the world, make a difference in a lot of people's lives. So I didn't have much of a connection to the rare disease community before then, but I really quickly fell in love with it, and I've been very happy to be involved ever since.
Awesome. I like it. Well, on behalf of the rare disease community, we thank you for your service to the community. So can you tell me about NORD? And for this episode, we're kind of diving into a grander scope of the rare disease community and different organizations that are involved. And what is NORD's unique position or addition to the rare and effectiveness to the rare disease community?
Sure. So NORD was founded in 1983, 34 years ago, following the passage of the Orphan Drug Act, the seminal piece of legislation that has very successfully accelerated the development of treatments for rare diseases, which are called orphan drugs. And following the passage of that bill, the advocates, the intrepid moms who worked together to get that bill across the finish line, saw that there was so much more work that needed to be done after the Orphan Drug Act had passed. So they put together a nonprofit organization to advocate for all rare diseases, and that was the National Organization for Rare Disorders. So ever since, we've been very involved in every way we can to improve the lives of individuals who live with rare diseases. Not just the policy office here, but we have other individuals in other offices who work on educating physicians on rare diseases, on spreading awareness on rare diseases, on helping the patient organizations that serve individuals with rare diseases in any way that we can. We fund grants projects, we develop registries, we do plenty of work. Anywhere that we see where we can assist patients with rare diseases or the organizations that serve them, we try to dive in head first and do everything that we can to help out. So I think NORD's unique role in the rare disease advocacy sphere is probably the way that we really fully encompass the full spectrum of ways that an organization could help the rare disease community. There are a lot of organizations that are focused on specific areas of advocacy, whether it be awareness, whether it be work with federal policy, whether that be in funding research. A lot of great organizations focused on those individual areas. We try to do it all. We have individuals here who work in all of those areas. And so in a way, we like to think that we're kind of a one-stop shop for patients or patient organizations that may be looking for some assistance. And if we don't offer that program, we like to think that we know who does. So we hope that we are, in a way, a clearinghouse for patients and organizations in the rare disease space.
Awesome. Yeah, well, and that's one of the things that I really appreciate about the rare disease community is that it's so collaborative. Like you said, if you guys don't offer this service, you're going to turn somebody to an organization in the rare disease space that does, and I really like that everyone working together, obviously all rowing in the same direction, right?
Oh, absolutely. I mean, there's just so much work that needs to be done that there's always there's no right of ownership. There's no selfishness. There's no any of that. That if there's someone else taking up the cause elsewhere and that could be more helpful or could be doing something that we're not, we view it as division of labor, if anything. That there's no shortage of things that need to be done, so the more the merrier.
I like it.
I have a question for you, Paul. Part of what you were saying spurs a different train of thought for me. So forgive me for sidetracking just a tiny bit. But in the terms of say, efficiency, or even the business minds that might be listening, most consultants would say you can't be a one-stop shop for all. Like you said, you got to find one or two, maybe three areas at most. Obviously, you guys are helping with advocacy, with policy, with, maybe helping fund this, that, or the other, all these different things that NORD's been doing. And as you mentioned, 34 years, that's pretty significant for any organization, really, especially one that is nonprofit status. So tell me, in your opinion, Paul, what are some of the things that you believe are helping make NORD, A, still here 34 later, and B, as effective as they are?
Sure. Well, I think the thing that has helped our longevity is the fact that the individuals, the other organizations, the other stakeholders who are involved within rare diseases, whether that be physicians, whether that be the federal government, state governments, whether that be the pharmaceutical industry, researchers, and so forth, they have come to know NORD as the voice of the patient, the voice of the rare disease patient. And that's something that we have tried very hard to maintain over these many years. And so it's a lot of relationship building. It's a lot of it's a lot of looking for collaborative ways that we can partner. All of these organizations, all of these entities have a very similar mission that we do.
Sure.
They all want to help as well. They all want to develop therapies for rare diseases. They all want to find diagnose new rare diseases. They all want to work for their constituents that may have a rare disease. But they also are looking through their own lens. Where we are particularly helpful is to provide the lens of the patient, and to work with them to really provide that viewpoint, something that they may not be able to really put on that lens particularly well themselves. So that's, I think, how we have remained as prominent and as relevant as we have, really to sticking to our mission, to ensuring that we look at every situation that is presented to us in the way that the moms looked at the situation back in 1982 and 1983, sure. To really put ourselves in the shoes of the patient and think, what would I want to see happen here? What would I prefer? What would I support? And then bring that viewpoint to the halls of Congress, or to the company, or to the researcher, or to whomever we may be working with.
How does another question for you, which is, why we're having this conversation in the first place, really. So I want to apologize for my questions, Paul, but I am curious. You talk about through the eyes or the lens of the patients. And like Kyle said, I'm incredibly grateful for you and the work of NORD. And like you said, so many organizations that are helping one way or another make life better. How do you specifically, Paul, in your role, how does your department or your office stay in touch with that patient perspective? You mentioned it just a minute ago. You're on the Hill, and you're constantly, I don't want to say fighting or battling, but you're going to battle for the patient with policymakers. How does your team remain in touch with the patient group that you exist for?
Well, really, in every way that we can, in every advocacy opportunity that we have, and every initiative that we try to lead, we first go back to our membership. And our membership is over 260 patient organizations. Over 70% of these organizations are tiny. They have fewer than 5 full-time employees within their organization. Many of these organizations are led by an individual that has the disease, or maybe they're a parent of a child that has the disease, sure. And they live it every single day. And so making sure that we're keeping, with every single piece, every single initiative, every letter that we write, everything that we do, that we work with patients or their patient advocates on these to be sure that we're accurately reflecting single day is paramount, is tantamount to making sure that we succeed in our work. And I say every time I talk with a member or a patient, it's really the most favorite part of my job, because it reminds me really of why I do what I do. And if my perspective has been straying in any direction or another, it brings me right back to exactly what needs to be done, and I think in doing so, I hope at the very least I've stayed true to the mission.
That's huge.
So, Paul, how do you see the patient perspective affecting policy and affecting healthcare? I feel like patient perspective is a buzzword right now, or a buzz phrase. And so how do you see it incorporated into the decisions that are being made?
Well, there are various different ways that it's being incorporated, both congressionally and regulatorily. First, congressionally, we saw in 2016 a bill that was passed called the 21st Century Cures Act that was really passed on the support of hundreds of patient organizations that put time and labor into getting that bill across the finish line. And the one of the good things about working within patient advocacy and within patient organizations is that everyone in policy wants to be your friend. You're on the side of everybody. Everybody is on your side. There's no one who is against your position. The only thing that you may run up against is people who may not be prioritizing your position. But once they learn about rare diseases, once they actually better understand the need, and once also they realize that likely someone within their own life is living with a rare disease, it's very easy to convert individuals over to your point of view. So back to your question about patient preferences. Again, people on the Hill, whether for good reasons or bad, they want to make it look at the very least like everything they're doing is in the interest of their constituents, and everything they're doing is in the interest of people who need a champion. And that's what we saw this past year with 21st Century Cures. Regulatorily, we're seeing within the review of therapies, we're going in a direction in which patient viewpoints, patient preferences, patient experience are actually being more and more prioritized in the assessment of a therapy, both in the safety of that therapy and in the effectiveness in that therapy. Historically, the FDA has looked solely at the scientific data. They've looked at the statistical analysis. They've looked at the p-values. They've looked at all of the statistical validations for whether the therapy is successful or not. But we're moving in a direction where we're adding additional ways for the FDA to assess whether a therapy is safe and it's effective, and if the benefits outweigh the risks. And that includes quantifying the patient voice, quantifying their preferences and their perspectives in order to present to FDA that this is something that patients really want. And this is a specific symptom that really needs to be treated, and that the benefits really do indeed outweigh the risks. And it can go the other way around. Perhaps that there are things that patients would prefer not to be within the treatment, or things that FDA may not have considered otherwise, but because patient preferences have been included within their review of a therapy, they'll look at it differently. So you're right, it's a buzzword. It probably means a lot of things to a lot of different people, but for the most part, it's almost always a good thing, and it means that we're going in the right direction.
Yeah, I agree. It's, you touched on the benefit risk equation, and that's always an equation, obviously, that weighing the benefits and the risks, and you obviously can't even formulate that equation without the voice of the patient, because we're the ones that are going to be taking those risks to get the potential benefits, and we formulate that equation. And so it's just an encouragement to all the patients who are listening that your voice matters, and in fact, it is the very reason for doing any of this stuff. It's the reason we're talking. It's the reason you go to the Hill every day, is to bring the patient perspective or to satisfy the patient and get something done for actual people.
Which I think is a huge point to make. That's really what's driving this particular episode with Rare Disease Day fast approaching. Obviously NORD has a big part to play in that, as well as other organizations. So let's turn the page to just a little bit, Paul, talking about Rare Disease Day and that patient perspective. What are some things that NORD is doing to help support Rare Disease Day? What are some of the efforts centered around Rare Disease Day for your organization?
Absolutely. So NORD is the official U.S. sponsor of Rare Disease Day. Rare Disease Day was actually started over in Europe by our sister organization, Eurordis. That was back in 2008 or 2009, one of those two. And then following the founding over there, we brought Rare Disease Day to the United States, and we've been celebrating for the last 8 or so years. We also operate the website rarediseaseday.us, which is a really good comprehensive look at all of the events and opportunities and ways to get involved in Rare Disease Day. And I'll go over some of those opportunities now. First and foremost, we support states, what we call state house events. There are events that happen in the capitals of the states across the U.S. We're not in all 50, but we'll probably be in about 30 or so states this year. And these events are coordinated by advocates on the ground, folks that are in the states that may even live in the capital or close to the capital, and really have a stake in how that state will influence policy related to healthcare and the other policies that would influence an individual's lives within that state. So we have state house events that are going to be starting in late February and going all the way into mid-March. And for folks who are listening, if you'd like to get more involved, it's very easy to go to the website, rarediseaseday.us, and look to see if there's an event close by to you that you could participate in, and that maybe you could even speak at, or maybe you could even lobby some legislators. I know in several states we're going to have lobby days attached to these events, in which we have the event, and then we actually go and talk to legislators about specific asks. Perhaps there's a bill within that state that could be particularly impactful for the rare disease community. Perhaps we're just trying to educate the lawmakers about rare diseases, because it's very likely that they haven't been approached by rare disease patients or organizations prior to that day. So those are the State House events, and those are just one type of event that we support around Rare Disease Day. There are other events happening at pharmaceutical companies and medical schools, in grade schools for that matter. Teachers who are looking to educate their kids on rare diseases and what they are. There are tools on rarediseaseday.us website to develop a lesson plan around rare diseases. So there are going to be events happening all across the United States for probably upwards of a month between mid-February and mid-March. Here in Washington, D.C., there is a Rare Disease Week that is coordinated by the EveryLife Foundation. And that Rare Disease Week encompasses several different events. The NIH is holding an event on February 27th. In which the top brass from the NIH come and talk about what they're doing within rare diseases and how the NIH is researching and supporting the rare disease field. The next day, there's a training for rare diseases, and then there's a lobby day. But I know that I believe at least that you're going to have EveryLife on the podcast, this podcast likely very soon. So I'm not going to say any more about that, because I'm sure they will have already said it, or they will be saying it soon. So I guess moral of the story is, if you're looking to get involved, there's something likely very nearby you to get involved in.
Awesome. Thank you.
So, Paul, you've been with Nord for 4 years. Rare Disease Day has been around, like you said, since 2008 or 2009. What do you think the change? What do you think? How has Rare Disease Day affected just the way things operate in the rare disease community and the way things get done?
Well, there are various benefits that we see that have arisen because of Rare Disease Day. First of all, it's a great way to simply just introduce yourself to a lawmaker or a doctor or whomever, introduce rare diseases to them. And something we've seen this, I've seen this at the very least within my work, in that I go into a congressional office that I may not have visited before, but they already know about rare diseases because they had a couple advocates visit their office on Rare Disease Day. And this is now happening in the States as well. With State House events that have happened over the course of the last several years, lawmakers are becoming more and more familiar with rare diseases, and there's a lot less unfamiliarity around the cause, and we're gaining a lot more champions in each state. So we're really successfully raising awareness within the policy sphere, at the very least, amongst lawmakers on rare diseases. And we continue to grow as well. The DC event continues to grow. Our reach within the states continue to grow each year. And it's exciting to think about where we could be 5-10 years from now if we continue along this pace, and just the amount of change we can actually make if we continue to grow as we are. So we're very excited about Rare Disease Day. We have viewed it as an unequivocal success, and we look forward to seeing it grow from now on.
I think Rare Disease Day presents an awesome opportunity to meet other rare disease patients and families. For me, going to the State House event here in Pennsylvania for the past couple of years, going to a Nord conference that I went to last year, and just meeting people and being in the same room and really understanding. When you look at somebody in the eye and you realize they understand exactly like some of the struggles that are in your life, it's a really powerful thing, especially when rare diseases make us feel alone a lot of times. And, on that level, I think Rare Disease Day is really effective in just making those connections between patients.
That train of thought or that line of thinking, it's huge because it helps also. Even for the people that aren't patients, it just helps keep the humanity of the battle fresh. Mm-hmm. It's not so far out of reach. It's not something that's dealt with in some third world country. It's what your neighbor deals with. It's what somebody down the street is living with. And that's one of the things that I walk away from every sort of event or meeting or any gathering where there are other patients involved. No matter how rare or orphaned the condition is or isn't, it's a good reminder, like you said, Paul, it's having an understanding of where the patient is and what they're up against. So that's one thing I really appreciate about these sorts of events.
Awesome. Yeah, absolutely. And I already mentioned it, but until people are introduced to rare diseases, they don't actually realize how much it has touched their lives. Sure, and I think generally when I introduce my role at Nord and talk to other individuals who aren't connected to the rare disease field about what I do and who I advocate for, and the common struggles faced by rare disease patients, it seems like everyone has that own personal story. He's like, actually, I think my father had something like that, or my friend has this, or my cousin has that. And then everyone realizes, I've heard from them how they don't really know anyone with that disease. And it is so interesting to find someone advocating for them. And do you happen to know someone with, the disease that my brother has? And could you connect me with that organization?
Sure.
And I have a conversation like that at least once a week, if not more. And it really just goes to show how rare diseases really do touch all of our lives.
That's crazy when to think about. Maybe this, what do they get, 6 degrees of separation or whatever the common phrase is. Maybe actually your degree of separation from a rare disease really isn't all that rare in and of itself.
Well, yeah, and especially when you're talking about rare disease in general. Like for me and you, Sean, like no one's ever heard of Friedreich ataxia before.
Sure.
Like I can hardly even say those words. Because there's only 5,000 people in the U.S. estimated that have this disease. But when we're talking rare disease, there's so many more people that truly understand, because so many of the struggles and challenges are very similar. Sure. And are the same a lot of times between diseases. And I think that's one of the, the obvious true power of Rare Disease Day is just connecting the whole community.
Paul, I got a question for you, just really kind of for fun and curiosity's sake. You mentioned the handful of bombs that helped get NORD started back in the early 80s. Are any of them still connected or involved in the efforts that NORD's known for today?
They are indeed. Our founder, Abby Myers, is still very active in the area advocating for rare disease. She's retired from NORD specifically, but she hasn't retired from advocating. She's going to be an advocate for life. I actually just saw her the other month, and she was talking about her experience with the Orphan Drug Act, and then the ensuing 25 years or so that she was president of NORD. And she actually just released a book fairly recently about her experience. So she's still very active. And then several of the organizations that are members of NORD are original members of NORD. Organizations like the Tourette's Association and organizations like the American Porphyria Foundation and Desiree Howe, who is the president of that organization. I find it as one of the greatest privileges to kind of stumble across the individuals who are still active, who were engaged 34 years ago, getting this across the finish line. And all of a sudden I realized, oh my goodness, I'm talking to one of the matriarchs of rare diseases. And then I try to get as much time with them as possible to hear their stories and pick their brains about the last 35 years, really, and to hear how they so successfully really changed the world for so many people so long ago at this point. So, yes, they're still out there. And they're still active, and there are true champions.
What are some of the policy things coming up that you would recommend we have a good follow on?
Sure. So there are a fair amount of short-term things. There are a fair amount of kind of medium-term things, and then a handful of really exciting long-term things that could really, really change the paradigm. So first, in the short term, we all know that healthcare in the United States is again being debated on what role the federal government should play, what role state governments should play. Essentially, how should individuals gain coverage for health insurance? And we see that being debated right now, almost literally right now, probably down on Capitol Hill. So if individuals in the rare disease community want to contribute their stories on their experience with health reform that was passed back in 2010, what their experience was like before then, if it's gotten better since, if it's gotten worse since, the opportunity is now, because lawmakers are discussing how to reform the system right now. And so if that's something that is of interest for individuals to get more involved in, I really highly recommend contacting congressmen, contacting senators, writing a letter to the administration on your viewpoint, and to see so that they really know the experience that individuals with rare diseases have gone through over the past 10 years with and without the Affordable Care Act. Also going on right now, there are FDA reforms being discussed, even on top of the reforms that were passed in December as part of the 21st Century Cures Act. Each 5 years, the FDA's user fees that go to fund the FDA. These are fees that are paid by industry, pharmaceutical companies, in order for the FDA to review their therapies in a specific timeline. That capability for FDA to collect those fees, has to be renewed every 5 years. And we're seeing that come up again this year. It needs to be renewed by September. And that's a substantial form of funding for the FDA. If that's not renewed, the FDA will lose a very substantial portion their staff and their capabilities. But this also allows advocates such as ourselves to look at the FDA and say, what can we improve? Is the way the FDA is working right now, is that the way we want it to work? And if not, how do we change it? And so that conversation is also happening on Capitol Hill right now. So 2 short-term opportunities to get more involved in. In general, kind of medium-term opportunity-wise, the entire environment around the development of therapies is likely going to be discussed in pricing, in value, in multiple different ways over the course of the next several years to try to move in a direction that is equitable, that is affordable, but still allows for the innovation, the robust innovation that we've been seeing over the past decade or so to continue. We've seen record number of orphan drugs being approved over the last several years. And in 2015, nearly 50% of all orphan drugs, nearly 50% of all drugs approved were orphan drugs. Really kind of a staggering figure if you compare that to years back in the 90s or the 80s, in which we were lucky to have 2 or 3 orphan drugs approved each year. So the way in which we develop drugs and the way in which we reimburse for drugs will be one of the main conversations that will be happening in policy circles over the course of the next several years. And then I just want to mention one final really exciting thing that we're seeing right now, which is the real advancement of science, the next generation of treating disease. And this is largely targeted to individuals or individual diseases, targeted therapies that target specific mutations, that target specific tumors, and potentially most excitingly, that are able to then actually fix that mutation through technologies such as CRISPR-Cas9, through other gene editing technologies. We may be approaching a time in which genetic disorders aren't for life anymore, in which we're able to actually develop these one-time, perhaps, therapies that an individual can take and actually be cured of a genetic disorder, something that has never happened in history. And that may be coming up pretty soon, within the next decade or so. And so I hope that maybe 20, 30, 40 years down the line, I can look back at this time and think, wow, we were right on that cusp. We were right on that edge of discovery. And now genetic disorders are a thing of the past. And that's what really excites me. And those are the issues that I really get excited about and that I feel really lucky to get involved in.
That's great. Thank you so much for sharing and helping us be aware of what's going on out there.
Yeah, really appreciate that. I'm super excited about all the stuff you just talked about, and I think the point of this episode is that we're in control. The patients and the advocates are in control, and it's up to us to make the effort to make the changes. Like you said, we get to decide whether things are working right or not, and how we can change them. And the power is in our hands. And it's driven by the excitement of a lot of the science. And so I guess I didn't really say anything new, but I was just reiterating, what you were saying. I'm just really excited. My heart's kind of pounding right now, just thinking about the potential of science and what we can all do together. Paul Melmeyer, thank you so much for joining us on the podcast today. We really appreciate all the work that you do, and we really appreciate the time you spent with us today to let us and our listeners know what you do and how we can help out the effort in the rare disease community. So thank you so much.
Well, it's been my absolute pleasure, and I look forward to the next time I'm invited to join you.
Hey, tell us again real quick, Paul, some of the websites or at least one of the websites I know you mentioned already, but where can our listeners go to check out more about you and Nord and what you guys are doing?
Absolutely. So for NORD's website, we're at rarediseases.org. For Rare Disease Day, that's rarediseases.us. And, if you want to chat, give us a call. Call us at 202-588-5700, and would be happy to chat.
Awesome. Thank you, Paul.
Awesome.
All right. Thank you for having me, guys.
Thank you for listening to the Two Disabled Dudes podcast. To find this episode and links to some of the stuff we talked about today, find us online at twodisableddudes.com or subscribe on iTunes.
We'd like to hear from you and feature your feedback and questions on future podcasts. Be sure to visit us at twodisableddudes.com to find our contact info and connect on social media.
Special thanks to our audio producer, Jake Tompkins, who also composed the music.
We'll share a new podcast every other week. We hope you'll listen and share it with a friend. Until next time, keep living with urgency.